Welcome to a few magical minds who've always guided us and with unwavering dedication. To our ever gracious Dean of Student Welfare, Dr. Shampa Chakravarti, who has always been the guiding light in students' life. We are humbled and delighted by your presence here, ma'am, today. To the faculty in charge, Dr. Parvin, whose support has been cornerstone of every thought of born by the axiom and budget. Our first speaker is a woman, extraordinary empathy and insight, a healer of hearts and sculptor of minds. Please put your hands together for Dr. Payal Chokar, founder of Kairos Psychological Wellness Center, a brilliant psychotherapist whose words today shall serve as lanterns for those navigating emotional darkness. Following here, we are honored to welcome Dr. Ankur Sachdeva, psychiatrist at ESIC Medical College and Hospital, Faridabad. His work has illuminated the field of mental health. His knowledge and gentle wisdom promise to touch both mind and spirit alike. I now call upon Dr. Shampa Ma'am to present a token of gratitude to our guest speakers, Dr. Payal Chokar and Ankur Sachdeva. Thank you, Mama. Thank you, our speakers. Now, the stage is open to Dr. Ankur Sachdeva.
Good afternoon, everyone. Thank you so much for the invitation, ma'am. Warm regards, and we look to this collaboration in future also. It is the most difficult time of the hour to be giving presentation post lunch. All of you are down, a bit down, I see. But I would request you to please gather up your motivation, gather up your energy, because the topic in itself is very important for all of us, especially for young students, as Dr. Payal and me, both of us have only focused on the college mental health. The aspects which are important from your aspect, and it is very important for you to at least know what sort of mental illnesses are common in students who are going to college and in later in your life also. So welcome all, and let's begin. My target today would not be to teach you much, but just to make you aware of what are the common mental illnesses that are prevalent and that are destructive for you in your careers if it might happen to you, how the early recognition should be done, and if the help is sought in time, how it can affect your life in a beautiful way. So as I mentioned, my objectives would only be three. First is to create awareness of the common mental health issues that affect college going students. By creating awareness, you would be able to at least partially recognize these mental health problems. And if you could recognize these issues within yourself, within your friends, your colleagues, within your family members, you might be motivated to seek help for them. What are the common reasons for mental health problem among college going students or young adults, as we say? As per WHO, young adults are individuals who've crossed adolescence, are between 18 to 25 years of age. I guess most of you would fall within that range, some up and down would be okay, but between 18 to 45 years of range is young adults. There are multiple challenges that you guys face when you join a new place or a new college. The most common are the academics, the change in the social diversity, adjustment issues in the new place, and some interpersonal domains. There is an exceeding pressure and expectation to do well from your family members, from your relatives, from your neighbors, or even दूर दराज के जो भी आपके relatives हैं who may not know you, but just know that you've joined a good college. The separation from family is very important because as of now, you were dependent upon your family members for your basic needs, or even to wash your clothes, arrange for your food, pressing of your clothes, everything they were doing for you, most of you. But now you are left independent. Although it is a matter of fun, it is enjoyment also. You cheer that feeling of independence, of freedom, but it comes with additional responsibility. Many of us are not prepared for that, or many of us are not adapted to that. There is process of individuation. When I say individuation, it means that this is the age when you try and explore yourselves, your real selves. You are not in the bounds of your family. You are exploring your new friendships, your new relationships, your relationships with your teachers, your academics. And this process, as fun, as entertaining it may seem, it is difficult, at least for some of us. Added on to that, there is still lack of knowledge and understanding of mental health concerns, especially in Indian population, because we have not been primed to what mental health is in our early ages in our schools. So all these issues, they combine and lead to predispose you in fact to several mental health problems if there is no good social support system, or if you don't take care of yourself properly. As I mentioned, there is pressure of responsibilities. When you join a new place, you have to do everything on your own, from setting your alarm to arranging your clothes, arranging your food, finances, everything you have to manage, and that creates an additional burden. Although in isolation it may not seem an important issue for all of you, but when you combine all the small issues that you have to face or you have to deal with, in totality it becomes a significant problem. Exploring relationships, your personal relationships with your friends, with your colleagues, your teachers, romantic relationships, all of these have to be dealt with within this age group most commonly. This is also an important time where you start experimenting with new things. Till now, you were within a safe space, within bounds of your family. Now, with the freedom comes experimentation. You experiment with drugs, different type of drugs. Be it simple drugs like tobacco, nicotine, alcohol, cannabis, to higher drugs like opioids, morphine, and other things. You experiment with your physical appearance. It is true for all of us. What happens is when you enter a new college, there is peer pressure. There is a pressure of looking good, looking up to your peers and looking up to your teachers. So you try to experiment with your body, with your dressing sense, with different things. And there is a new concept of sexuality. Some of us are exploring. We have seen many of the college going students who are not comfortable with their sexuality or their genders, and they want consultation for the gender change procedures and different contents related to it. Also, because you are out of your home, there is physical inactivity, pressure of academics, and unhealthy diet. Most of you tend to order food from outside. It is very readily available nowadays, and many of you would skip the hostel meals or the home cooked meals. So it is proven fact that physical inactivity, obesity, unhealthy diet, it is a predisposing factor for mental health problems. Along with all these problems in the college, there comes fierce competition for opportunities. Competition to score good marks, competition to do well in your life, to do well in your exams, and to find a good placement, find a good job. Also, socioeconomic transitions all of you, I'm sure, would not be from the same socio-economic background. Some of you also must be from smaller towns, villages. Some of your parents may not be earning as much as your friend's parent would be. That creates some disparity, which, if your friendship bond is good, you would be able to leave it. Otherwise, it would create a deep sense of insecurity within you that might predispose you to mental health issues. And disintegration of social networks that you had created during the school times, your school friends, your neighborhood friends, your family, your brothers and sisters, your relatives, you've gone away from them, and it is the time to develop new. So, being science students, you must be interested in some statistics, some facts. So I've just put one slide of how this mental health pandemic, in fact, is affecting college-going students. This data is only for the college-going students 18 to 30 years of age, not 25, 18 to 30 years of age within the last 2-3 years only. And this has been taken up from very big studies conducted by premier institutes of India like AIMS, NIMHANS, Bangalore, and some other colleges. So anxiety disorder in general population, the prevalence is around 10 to 15%. If you see in college going students, it increases to 30%. What are anxiety disorders? We'll get to know. Depression in general population, it ranges between 8 to 10%, 15 to 20% in college going students. 15% of these college going students who were surveyed had suicidal thoughts at any given point of time. Not at that point of time, but within their duration of their college course, at any given point of time, at least one point of time, they had the suicidal thoughts, and around 7% had made few attempts to even harm themselves. So this is a huge number when you compare to the general population. The problem is that only 1/3 of these individuals share their issues with their friends, their family, their teachers, their counselors, or anyone. This is where the major concerns lies. That the problem is big, but you guys are somehow not able to share. There are different factors of which, and I'm sure you must be justified. You must be justified in not sharing it, but this is a big problem. Drug use ranges from 20 to 60%. This is including all category of drugs. IS consumption is seen in medical and engineering colleges, which is pertinent to you. Tobacco, alcohol, and cannabis are most frequently used drugs. Around 6 to 8% students in engineering, in medical colleges, or in other colleges use cannabis in one form or the other. It is more in engineering and medical students, but in overall also the average is 6 to 8%. Let's come to the main objective of the evening, which is the awareness and recognition of basic mental health disorders. I'm sure you must be knowing something or the other about the mental health problems that have been highlighted here. But here also I would like to give you one chance that whenever you have any doubts or you want to seek any clarification, you interrupt me there and then only. Just raise your hand and I'll get back to you, because it is important to understand all of the psychiatry cannot be covered within half an hour. So what I've tried to do is to include the most important points that were pertinent to you or that were important to you and highlighted here. So there would be many things that would have been skipped. So if at all you have any doubts, please raise your hands and get back. Most important or the most concerning thing is stress and burnout. Stress, can anyone tell me what is stress in simple terms? Any of you? Stress, anyone? Please.
Sir, according to me, stress is the condition in which we don't know what we have to do or we are under a lot of pressure, I think.
What was the first line that you said?
Sir, stress is the condition of our body in which we do not know what we have to do.
So see, if we go at very basic level, stress is any change that your body or your mind has to face. Any change. You were called for this seminar, that was stressful for you. You had to give your exams today, or exams are going and you were told that is stressful for you. You have to wake up at 6 o'clock, 7 o'clock, 8 o'clock in the morning, that is also stressful. Everything that you do is stressful. Everything. Even food you eat is stress for your body, because that your body has to digest your food. It has to work. It has to release certain enzymes, certain hormones that aid in food digestion. Everything that you do is stress. The problem is that what we think is stress is not good for our body. That is not correct. There are different forms of stress. The most common form is eustress. Eustress is the good form of stress. Are you aware of Bell's curve? Bell's curve पता होगा ना? This graph would represent more or less a Bell's curve, where if the stress levels are very low, you will see that there is no pressure upon you. You won't be motivated to do anything. You would be just lying around your bed if you don't have anything to do. That is also harmful for you. If stress is very high, it can lead to mental health issues like depression, anxiety, and other aspects which we will touch later on. But if stress is at the appropriate level, where you can deal with the stress in a good way, then stress is very good for you. It motivates you to prepare for exams. It motivates you to get up and go to gym. It motivates you to do certain things which are good for you. So appropriate levels of stress are always good. It is always the low and the high levels of stress which are harmful. When the body is under stress, our body is made up wonderfully by God. If you believe in God, it's fine. If you don't, then also it's fine. But it is made wonderfully well. Your body is equipped to handle stress and any kind of changes that your mind and body faces in a very good way by different mechanisms. However, when the stress is persistent and continuous, there is a stage which we call as burnout, where the body's defenses die down, or they are not up to the level where body can repair itself. At this stage, there is state of physical, emotional and psychological exhaustion. This is where you start facing, or you start realizing some mental health issues within yourself, and you will see or you will feel amongst your friends also. Very interesting to note that studies across the world have mentioned that around 50% of absenteeism in workplace is stress related. So it has a huge potential for any workplace. Over 50% of employees at any given point of time are stressed. If we apply the basic standard scales of stress assessment, you will yourself find that more than 50% of employees or students, they are stressed at any given point of time. Leave aside how your friend is behaving with you. He or she might be laughing, might be eating properly. That does not mean he or she is not stressed. It is the deep down that you have to look within, and that comes with experience, or that comes when the other person is ready to share things. So the next common group of disorders are anxiety disorders. I'll cover a brief about all of them so that you know what we deal with in mental health ecosystem, and if possible you can just assess the people around you. You can just be aware of these things, you can recognize, and you can ask them to seek help if possible. The common anxiety disorders that we see in our daily clinics are phobias, social anxiety disorders, panic disorders, and generalized anxiety. So anxiety is a state of mind where there is this intense, excessive, and persistent worry or apprehension about everyday situations. You keep worrying कि आज एग्जाम कैसा होगा, आज मैं लेट तो नहीं हो जाऊंगा, मैं अगर पहुंच भी गया तो मैम गुस्सा तो नहीं करेंगी, वहाँ पे अगर मुझसे कुछ पूछ लिया तो would I be able to answer or not, would I be able to study good or study well tonight, would I be able to eat properly, would I be able to sleep properly. These are all worries. So if these are persistent, they take a form of anxiety. Depending upon the forms of anxiety, there are different disorders. Phobias are worry of a particular object or situation, like of heights, like of insects, okay, like of different other objects, fire. Social anxiety is when you are not comfortable in social situations, like giving presentations, like eating food in public, like meeting new friends, meeting new people. This is form of social anxiety. Panic disorders are when you have these anxiety attacks in short bouts. They improve after a few minutes or few hours, and you will be relatively well over the next few days, but they will come again in bouts. Generalized anxiety is when someone keeps worrying most of the time about something or the other. So, what are the common symptoms of anxiety? They are feeling nervous, restless, or tense at that point of time. There is increase in heart rate. The person is breathing rapidly. He is sweating or trembling. The body is shaking. There is trouble concentrating and sleeping. When all these issues come together, it gives a form of anxiety disorder. Depression, everyone's loved one. तो डिप्रेशन सबको अच्छा लगता है सुनने में. It is a new term that says कि भाई it was a hip term at point of time I'm depressed and sad. Can you tell me what is the basic difference between being sad and being depressed? That is probably the most important takeaway point of today's presentation.
It depends on time.
Good.
Time. If it is persistent for more than 2 weeks or months, it takes the form of a depression.
Very good. He is a psychologist in itself. So, depression is when your sadness is persistent and pervasive over a period of 2 weeks. That is as per classification. But depending upon the severity, it can be a week also, it can be 3 to 4 weeks also. That is fine, but as per classificatory systems, it is 2 weeks. So, a person can be sad due to any situation. He can be sad because you've not scored well, you've had a relationship issue, your parents have said something to you. You can be temporarily sad for a few hours or a few days. That is not sadness. Sorry, that is not depression. That is sadness, not depression. Sadness is just one aspect of depression. What symptoms I have included in the second line are, they also need to be there along with sadness of mood in order to be classified as depression. So if you see a depressed person, you would be able to make out that the person looks very sad. He looks very tired and lethargic. There would be loss of interest in activities that he or she would have enjoyed earlier on. Like if you enjoyed swimming earlier on, playing sports or music or dance, anything. But now you're tired and you don't feel like doing any of those activities, that is a major symptom. Along with that, there are other symptoms like social isolation. The person won't interact with the friends now. Sleep issues, feeling of hopelessness and helplessness. That I won't be able to improve, nobody would be able to help me. Suicidal thoughts or attempts. Poor concentration, there would be issues with the memory. You won't be able to recall or recollect things. Even when you study hard, you won't be able to gather everything. And there would be reduced efficiency. Most people with depression will feel well with psychotherapy, counseling, or the medicine. However, the feelings of hopelessness and suicidal thoughts are an alarming risk factor for the patient actually doing any instance of self-harm. If these two symptoms are present in any individuals, you have to be very careful and immediate referral should be there. OCD, obsessive compulsive disorder. I'm sure you must be aware of it. One thing I want you to know about OCD is just not hand washing. Most of us we relate OCD with hand washing or washing something again and again. So OCD is made of two words. First is obsession, second is compulsion. Obsession are repetitive thoughts, repetitive intrusive thoughts that come to your mind again and again even when you try to resist them. Your mind, for example, I am touching this mouse, alright? So, what is an obsession? My obsession is that I continuously think that this mouse is dirty. I know it is not, but still that thought will continue to come in my mind that the mouse is dirty. It will cause such anxiety to me that I will have to follow a compulsion to relieve myself of that anxiety. Obsession is thought, compulsion is an act which I have to do in order to reduce the anxiety associated with this obsession. So compulsion are repeated acts and anxiety is, obsession is repetitive thoughts. Themes can be contamination, which is the commonest one, which you commonly know with hand washing and all. Second is checking. Person will continue to check locks, to continue to check bolts, whether I have put in locks, whether I have housewives, very commonly they come that I continuously go and check whether I have closed the stove. When I have closed the stove, whether I have put in the locks, रात को उठ के 2-3 बार देखते हैं. Even after sleeping, we get up at night and check whether I have locked the door. And that does not happen for once. It is continuous and it is regular. Order and arrangement. There are people who need a particular order in their life. Like if this mouse is kept this way, they will say no, keep it this way. Okay. ऐसा ही घर पे भी होता है. If pencils or pens or things are lying here, they'll keep up and put in place a particular order. Okay, you realize their clothes are tied very tightly. बहुत अच्छे से रखते हैं, एकदम सेट करके ऐसे रखेंगे. And if there is slight movement to their clothes, slight movement of symmetry, they'll get anxious. They'll keep doing it until they are satisfied with the placement of these objects. There are certain other obsessions also like blasphemy, which are religious obsessions and sexual obsessions also. So obsession can be of anything. It just has to be a thought which is coming to your mind regularly, repeatedly. You want to not think about it, but you cannot stop it. Okay? So next is psychosis or schizophrenia. So it is a serious mental health condition which has to be dealt intensely in the early point of the mental health problem. It cannot be left for late treatment. It has to be referred immediately. In these disorders, what is affected is how the people think, feel and behave. It includes two major problems. There are many others, but I have included two, which is schizophrenia and bipolar disorder, specifically the manic phase. Mania is exact opposite of depression. If in depression you are very low, in mania you would be hyper excited, you will be over enthusiastic, you will have increased energy within your body, you will be over talkative, you will not be able to sleep, you would be active, you would be meeting friends, spending much more amount of time and money on useless activities. Here where you will see hallucinations, delusions and problems with your thinking and behavior. Do you know what are hallucinations and delusions? Any idea?
When somebody experiences things that are not actually happening, they are assuming that things are happening, but they're not happening actually.
Very good. What is that?
Hallucination.
Hallucinations. Okay. When you start imagining things, but for the person that is not imagined, for the person that is real. That's why in the last para you will see that I've mentioned that individuals are at loss of touch with reality. They cannot separate what is real and what is not real. So these individuals, when they start imagining things which are not there, like people, most common are auditory hallucinations. Hallucinations are disorders of perception. Perception can be in 5 senses, all the 5 senses that you have. Patient can hear things when actually no one is there. Patient can feel something happening to their skin or their body. They can taste or smell something, or they can see objects or people when no one is actually there. So those are hallucinations. Delusions, anyone can tell what is a delusion?
False perception of reality.
Perception, if false perception is hallucination. Delusion is a disorder of thought.
Somebody is creating scenarios in their mind that scenarios that might not be possible.
Delusion, if I have to put it very simply, is a false belief. A belief that people are trying to harm me. Belief that people are talking about me. Belief that I am powerful than the President of America. Okay. So all the beliefs which are not possible, practically possible or plausible, if a person has those beliefs, that means it's a delusion. And that is a hallmark of psychosis. Hallucinations and delusions are hallmark of psychosis. If it is there in any individual, help should be sought immediately. Substance use disorder, famous among college students. So alcohol, nicotine, cannabis, opioids, sleeping pills, multiple sleeping pills, MDMA, which is also called ecstasy, cocaine. They are different drugs which are seen in college-going students. I have told you about how common it is amongst medical and engineering students. Social drink and leisurely drink is different from harmful or dependent use. What is harmful and dependent use? Harmful use is when you drink beyond a pattern which is safe for you. What are the features of harmful use? First is tolerance. Many of us drink, which is not harmful, that is okay. But what we do is, throughout our lives, we restrict ourselves to a particular quantity of alcohol or smoking or any other drink. For example, if an individual is consuming 1/4 of alcohol, he'll continue to do that over a few years or over his lifetime. There are many examples of that. But if a person develops tolerance means that the same amount of drug is not giving you the same kick which it used to give you earlier on. For example, initially you were happy with just 1/4 of alcohol, but now when you consume 1/4, you don't feel anything. You need to take more amount. Okay? More amount of alcohol to get the same kick as you used to get earlier on. That is tolerance. Then craving. You would crave for that substance. Even on the second day or the third day, you would feel like having that if you've not had that. Other is withdrawal symptoms. Those are very important. Alcohol, cannabis, opioid, they have certain withdrawal symptoms. If a person is dependent or if a person is using any substance in harmful form, when he or she will stop using that substance, he will feel restless. He will have difficulty in sleep. He or she will feel that their hands are trembling, they are having anxiety, they are having headache, sweating. Different features will be there, which is specific to the type of substance you would be taking. So if you have these features, then probably you are consuming the drugs in harmful or dependent pattern, which is totally not acceptable, and you should seek help. Also, these drugs can lead to different medical the new age disorders, two of them, internet use disorders, and the next would be the eating disorders. Internet use disorders is still under the category of disorders that have to be explored in the recent classificatory systems for mental health disorders. However, internet gaming disorder is now a part of the classificatory system. That is an established diagnosis, internet gaming disorder. So we use our phones for multiple purposes. Internet is virtually free. No payment has to be done. And there are various reasons why we are hooked onto internet more than the earlier. For that we have to go deeper into the psyche of all of us. So that is beyond the scope of the today's presentation. So people who have the internet use problems, they are more likely to develop depressive symptoms, sleep issues, and they're more likely to have academic issues and severe disturbances in interpersonal life. Eating disorders, 90% in females. I'm saying 90% because it is more prevalent in females. three major disorders are anorexia nervosa, bulimia nervosa, binge eating disorders. The basic problem in these disorders is that an individual feels that the body shape is not as per the norms they have set them for themselves. Your friend and family would feel that you appear totally fine, but that individual would feel that no, my body shape is not proper. I am fat, I am obese, even if he or she weighs 50 kgs. So the problem lies in how the individual thinks about the food, the calories in the food, eating behavior, weight and shape. There is unhealthy low body weight. There is intense fear of gaining weight. That is why the girls or the ladies, they resort to eating very low amount of food. The ones who have these disorders, and with a view of weight and shape that is not realistic. So there are different adverse consequences of having the mental health issues at early point of time. There can be dropouts. There can be poor academic achievement. There can be issues with your employment, your self-esteem, self-confidence. Substance misuse can be on the rise. There can be instances of self-harm, and it leads to poor social relationships in later part of your lives. The last thing is when to seek help. It is important for all of us. When these problems, even if you're not able to recognize these problems, but you feel that something is causing severe personal distress, I'm not comfortable with what is happening. Exercises, different other things before going to a counselor or a therapist. So if you've exhausted all these things and if you still feel that it is not helping, then probably you should seek help from an expert. So this is the framework for mental health care at college level. The case detection, it starts from the teachers, yourself, your peers or colleagues, or your family members. Then the second level is the college counselor. College counselor would tell you certain preventive or promotive steps. There can be some interventions in the college, or if it is not helpful at that level, then the final step is referral to a mental health specialist. With that, I would like to end my presentation, and if you have any doubts, I would be happy to answer those. Anyone?
So,
Yes, please.
sir, is there any kind of oral test or something like that to distinguish that someone is sad or someone is depressed, or a clinical test through which professionals do identify that this person needs a consultancy or it's just normal
Okay,
sadness?
very good. So what he's asked, if you couldn't hear, is that are there any tests or any methods to assess whether the patient is actually sad, depressed, or having any mental health issues, and whether he needs a referral or not? So there are certain well-established tests in Hindi and English both. There are names of certain questionnaires which I'll be able to tell, but beyond this, the domain of today's interaction. Which, if you apply on any individual, there are certain self-rated scales as well, which you can just take out from internet, apply on yourself, and you can just see the scores. Or your friends or a trained professional can apply on you. And based on the cutoff of the scores, you can say that the person is depressed or non-depressed. Even if the person is depressed, they will give you the categories of depression: mild, moderate, and severe. Same with anxiety, same with OCD, same with all the problems that I have mentioned. And once you know that the person is moderate to severely depressed, these scales themselves suggest that help should be taken at this point of time. For mild depression, scales would not ask you to take help, but the scales itself or themselves, they will suggest that if your scores lie within this range, that you need to seek help. You want name of these scales? So one is vexed depression inventory. The second is hospital anxiety and depression scale. Third is depression, anxiety, stress scale. All three are available in Hindi, English both. You can apply on them yourselves. There are cut-off ranges and scores. And these three scales are easily available for anxiety, stress, depression. Okay. Yeah.
So there is a lot of misconception about psychiatric medication, mainly due to its side effects. So
Yeah.
how to raise awareness about that they are safe?
See, what happens in India is that once something starts, it goes on for the next 20, 30 years. That is the problem. So before the year 2000, there were very limited psychiatric medicines. Okay, and most of them had certain side effects. There's no denying that. And there were some which were habit forming also. There were some. But when you see the risk benefit ratio, you must be aware of what risk benefit ratio is. I think आपके curriculum में कुछ तो होता होगा. Then when the benefits of a particular thing outweigh the risks associated with the other thing. Okay, when the benefits of medicines, they outweigh the risks associated with the disease itself. Okay. It was considered safe to give the medicines to those patients. But beyond 2000, there has been so much work in the field of pharmacology and medicines that we have certain exceptional medicines, okay, which are relatively devoid of side effects. If the side effects are there, they are very minimal. And trust me, if you go to any professional, they would apprise you of the side effects first and then start you on the medicines. Okay, nobody wants to take the risk that they won't tell you the side effects and start the medicine without informing you of those. Even if the side effects are, the commonest side effects are like gastric upset, nausea, feeling of this acidity, that are more common, that are common with most of the medicines, even antibiotics that you take, they can have such side effects. So nowadays medicines are very safe, very reliable. We know what side effects to expect, what not to expect, and as of now, I don't think there should be any stigma or any hesitation with regards to the medicines. Anything, please? Sir.
I don't know about the OCD. So if someone is suffering from suicidal disorder, chatting, how to
Sir, see, he's asked very important question. How to improve if you think that you are doing a particular things in a it should cause some distress in your social, occupational and personal life. It should cause some distress. If I am sad, but it is not affecting me, it is not affecting my work, it is not affecting my personal life, there is no need to seek help. If you are arranging things, but if it is okay, it is not hampering anyone, it is not hampering your work, your own life, your personal life, your relationships, there is nothing to do. But if it is affecting you, if you are wasting, if you're coming and you're wasting 1 hour just trying to arrange your cabinet on a daily basis, twice or thrice per day, then it is affecting you. Okay, then you should seek help. As what sir has asked, what you can do on your own. There are certain self-help groups online that you can find. There are certain tips and skills that can be learned online. Okay, but these are not minor disorders. OCD, once if diagnosed, it should be treated carefully and intentionally with help of some professional. And if the disorder itself is mild, the therapist will tell you certain skills. There are certain therapies like exposure and response prevention, and there are certain other therapies also which the therapist would tell you to apply. If the disorder is moderate to severe, you need to take medicines for that. That is for sure. But if the things are not affecting you, you are relatively fine with what is happening, there is no need to take medicine. Anything?
Many people, sir, they do drugs or some type of, like they take alcohol or as a coping mechanism for stress and anxiety, and hence they get dependent on this thing in future. So in that case, how would you want a person to be these kind of?
Management, Dr. Payal will cover of whatever I have discussed. So see, I'm telling you, stress management in itself is a 2 to 3 hour seminar. Only stress management I'm telling you. If depression, anxiety, how to manage this, these are full topics, big topics. Everything cannot be covered. But what you are saying is absolutely right. Some people use it as coping mechanism to deal with stress and anxiety. And how to deal with it, she will cover.
I'll give answer to, because it's one of the most important questions that he has asked. Yes, so I'll be answering.
So thank you so much. I'll pass on the mic. Yes, yes.
Actually, all psychotic seem to be developed side effects. What are, for example, antidepressants cause depression? One of the side effects of antidepressants probably it increases anxiety or depression. So, from modern science point of view, what is the progress that is taking place and how much confidence and trust we can place on medicines as a treatment part of psychotic?
Fair enough, ma'am. So if you read about antidepressant medicines online, okay, on Google or any platform, the thing you will, if you type the side effects of antidepressant, so initially it will say anxiety and all these things. That is true. But what it won't tell is that anxiety would last for only a few days. The anxiety is initial. Slowly your body will cope with it. In 3 or 4 days time, the body will adjust to these medicines and nothing will happen. They do cause initial anxiety, but to cover up those anxiety, the doctor would definitely give some other medicines for a short period of time to cover up for those anxiety. Okay. And ma'am, as of now, the field of pharmacology has progressed extensively. There are even antipsychotic medicines which are used to treat psychotic disorders, which have minimal to minimal side effect. Even safer than, I would say, an antibiotic. Yes, there are certain medicines like that. So they are in the market and they've been developed in the last 5 to 10 years, most of them. And they are very safe, moderately effective but safe. Because people are more concerned about side effects than they are about the effects. So what the companies are doing, they are making medicines which are safer with respect to side effects. Probably the effectiveness is compromised from significantly effective to moderately effective, but the side effects have been reduced to an extent that even if you or I take, a normal individual takes, nothing will happen.
Now one more question.
Yes.
So sir, it's about a self-report questionnaire. So if somebody is using the questionnaire, can they rely on the result of a single test?
So, yes, see, the questionnaires that I mentioned, or all those self-reported questionnaires are just screening tools. They are not diagnostic tools. So, if you have a score beyond a certain point in these screening tools, it means that you have some problem. Okay, it might not be depression or anxiety. You might not need help for that clinically, but you are at a risk, and you should definitely go seek help with someone. Probably that therapist or that doctor will talk to you, and you might not need medicines for that. But it shows that you are at risk and you are beyond a safe limit. Those are not diagnostic skills. See, in psychiatry, the beauty is that all the diagnosis, 100% of the diagnosis is clinician made. No test, no MRI, no CT scan, no blood investigations, no scales can make diagnosis. Diagnosis has to be made by a doctor. These scales just assist them or just help them in making these diagnoses. They are just helping tools. They are not the diagnostic tools. Okay, with that time I end my presentation. I invite Dr. Payal for her speech. Thank you so much.
Hello, am I audible? Am I audible otherwise? Because I think I'm loud enough. Huh? That would be good. Yes, I am pretty loud. Okay, first of all, I welcome you all, students, and thank you, Dr. Shampa, for giving me this opportunity to talk about mental health. Can I request people sitting just this column to please, in case, मेरे लिए थोड़ा सा ना to maintain that eye contact is very important for me to know that my audience is with me. Thank you so much. And the other request that I would like to float humbly, kindly either put your phones on silent or just remove it, because I'm here to talk about social media addiction. Restrict that. तो अगर हम अभी नहीं कर पाएंगे तो नहीं कर पाएंगे, है ना? Right? We must learn to just sit, no? To either listen to somebody, even if I'm boring, I'm sorry, I'll try not to. Okay? So, first of all, thank you to Dr. Dr. Ankur also, who has given you almost a very, the concise, description about disorders. He has made this base for me. So, I think what I will be covering, where is my ओके, मुझे जानना है मेंटल हेल्थ होती क्या है, क्या पता आप लोगों को मेंटल हेल्थ के बारे में? जैसे फिजिकल हेल्थ है, so we can attach words like exercise, diet, right? मेंटल हेल्थ के साथ हम क्या वर्ड्स एसोसिएट कर सकते हैं? What is mental health? Give me, let's make it a more interactive. मैं और उसको बोलिए Please tell me, what is mental health? Any word that comes to your mind when I say mental health? Stress, anxiety, okay. Overthinking, yes, overthinking. Overthinking. Happiness, yes, one positive word. Mental health का positive भी तो कुछ होगा? Yes. When we say peace of mind, we say calm state of mind, right? Balanced state of mind. Okay. I also want to know from all of you, because I am seeing a lot of students. I think importantly post-COVID मैं ज़्यादा देख रही हूँ. मुझे आप लोगों से ये उत्तर चाहिए होगा कि स्टिग्मा क्या है, क्यों नहीं हम मेंटल हेल्थ के बारे में बात करते हैं? Why? I'm not talking about you not talking about it. I'm generally talking. Mental health के बारे में लोग बात क्यों नहीं कर रहे? Why is it so important to tell somebody कि I am going through a phase or a state.
Fear
and
of-
I am seeing a psychiatrist or a psychologist.
Fear of judgment.
Negative image किसकी? आपकी? Yes, that's what I'm saying, right? कि मेरी negative image जाएगी कि this person is going to a psychiatrist or a psychologist. Yes, absolutely. So this is known as fear of being judged. Right? But आपको नहीं लगता in this, you are the Gen Z or the latest modern generation which we expect a lot from you to change future in terms of not just technology, part of being such a renowned institute. But हमें ये mental barriers break नहीं करने चाहिए. और अगर हम खुद से शुरू करें तो if I am not able to address my own issues, that stigma will never be dissolved. Never. It has to start from one. Because I hear my own, sadly, my own group, my own circle, especially males, I'm sorry I'm not giving a very gender biased statement here, but they say I don't like to share my problems with others, no? Because it might look like I'm weak or this boy is not able to handle his problems. ये males में थोड़ा सा मैंने ज़्यादा देखा, right? So the society somehow has told us that males are not, you are not supposed to share your emotions. ऐसा कुछ भी नहीं, right? I think the new machoism is to become more emotionally aware and to become more emotionally sensitive. Okay, so we'll be covering more about the mental stigma, right? Let's talk about this stage from school to college. So first of all, I want to know that who are from first year, second year, third year. कैसा batch है first year से कौन है? First year, okay, just I think 7, 8. Okay, second year and third years, mixed. Okay. So I think specifically this transition phase will make more sense with the first years. Because second years थोड़े अभी adjust हो गए होंगे और third years को भी यहाँ से third fourth को भी यहाँ से जाने की. So talking about the transition age. Yes, it's done. What? Do I need to stand? अच्छा, it's stand. It's stand. Yes. Okay. So I specifically made this slide that when we were in school, I was like, if I talk about myself, I was very excited to be part of college. I hate my school, now I want to be in college, enjoying that autonomy to be able to wear what I want to wear, or to be able to go where I want to go, right? But autonomy and freedom comes with a lot of risk as well. Right? It does. Because it's a more structured environment where you have a routine, where you know what to do, there's a teacher, everything is more structured, right? But in college, when you get this autonomy and freedom, do you agree with me that we're not able to really make use of it at its best? So, some of the misconceptions I've written that, especially for the first years, you need to have everything figured out at your first semester. When we enter, we think that we will figure out everything so that the journey is smoother, right? You need to know what you want to do for the rest of your life. You need to figure that out everything by the time you've completed your first year or second year. You don't actually have to go to class. College is all about academics, studying, and you have to go to parties if you want to make friends, right? You won't feel homesick if you're enjoying college. ऐसा तो नहीं होता है, right? So see, this transition age, why it is important? Because this is actually the age where we are, this is potentially the first time we are experiencing so many things. Dr. Ankur also talked about it. ये तो change है, right? Exploring new relationships, trying to, fit into the world by interpreting them in your own ways, right? अब आपको कोई बताने वाला, गाइड करने वाला नहीं है, unlike in school, right? So, change in the routine, lifestyle, social demographic changes हैं, right? Substantially, okay. Specifically to NSUT and colleges like this is a substantially more competitive college university as compared to others. बाकी जो DUK colleges हैं, right, where there are different fields and all, इस तरीके का this competition is not there. I mean, that's why I'm saying substantially higher. And if you see in school, it was easier to, come first, second, third, fourth, and use 40 or 50 ka classroom. But here, when you have, all people selected from a, good ranks and everything putting together, so it is relatively difficult. Correct? Relatively difficult to make that stand here, and that is what makes us anxious. That whether I will be able to hold a position in the classroom. Right? But, dear students, this discomfort and stress is normal. Every one of us goes through it. So, फर्क क्या है? Why some people deal with stress better is what you were talking about, coping mechanisms. I'll be talking about resilience, right? Some people resort to unhealthy coping mechanisms. That is why they are not able to overcome the hurdles, burdens, whatever comes in their way, चाहे छोटा, चाहे बड़ा, in whatever area, academics, relationship, your, personal life, day-to-day routine, everything. That is the difference. So I will be talking more about what we can do individually, at an individual level, okay? So, change is the only thing that's constant. Flexibility is important so that we are able to adapt. This is a new environment. I mean, especially I'm talking about the first years here and second, third, fourth, so on. They have adapted, no? अभी भी कोई ऐसा है जो कह सकता है relatively I haven't really adapted well to this environment because yes, I had a student from XYZ college. So she said that I am not able to adapt and she was in second year. Right? अभी भी कोई ऐसा है जिसको एक feeling है I'm not able to adapt, I'm not relatively adjusting. No? Okay, anybody, how many of you are staying in campus here? Okay. So, are there any different challenges that you face?
In hostels, certainly face many challenges because the environment is not like it was at your home. The food is not as good as it was at the home, and say your home. So those are the things that add up to the discomfort of it.
Yes.
Firstly, you're homesick, you're missing home, you're missing your parents, and then the food is bad. There's a room you need to share the room with two.
What's the name here? Deepti, tell me how is it affecting your, let's say, academic life? Academics के बारे में ही बात करते हैं because I think everyone here talks of academic pressure या studies खराब हो रहा है.
Right. That's
How
a
is
very
it
great, but
affecting?
it does affect academics.
It does affect.
You are 3 roommates in one room, which is majorly the case.
You have three?
3 roommates in one room. So one of the roommates wants to study at the time,
Yes.
the other one does not, and so on.
Yes.
So it affects your sleeping cycle, and then you're not able to sleep, and then not able to study. Somebody wants to be allowed to learn, that's their learning
And
method, and the other one does not like if somebody is reading around quiet style study.
Yes.
That affects a lot.
Yes.
Sometimes people do call their friends to their and then the other ones do not like that. Other people are sitting talking while I'm studying.
So,
It creates a lot of problems.
yes. So, see, thank you Deepti for sharing this with us. Now, as compared to people those who are still at home, comparatively, okay guys, I'm not talking this as a black and white thing, okay? Comparatively, Deepti has more stress to handle. Comparatively, she has to manage these things by herself, right? So this might not be issue with people coming from their homes, comfort, घर जा रहे हैं, खाना मिल रहा है, right? They don't have to wash their clothes or other things which she has, right? So you have to be more cautious. Now getting it? We can identify people like this who by default who are vulnerable to become anxious. So if you are not handling these things carefully, right, might become anxious about it later also. आप देख रहे हो हमें कैसे identify करनी है उन चीजों को, right? Okay. So embracing change makes a smoother transition and promotes personal growth. This is what I'm talking about. I think Dr. Ankur has already talked about the common stresses which are there in this transitional stage. I think one particular thing which I would like to know, especially from the 3rd year or the 4th year, placement anxiety. कुछ है किसी को यहाँ पर? Second year से शुरू हो गई. Alright, okay. Why? Because I think I don't know, ma'am. I've read this some article on Google about the last year company package. Was it once a year?
Actually, from 3rd year they go for internships.
Yes.
And that becomes pre-placement.
That becomes pre-placement.
So I mean, they are expected to get a job in the companies they are doing internships.
Yeah, yes.
So it's very important for them to get to a company to do their internship. So that would cause some stress.
Yes.
And so what is salary practice? It keeps on going up and down.
I mean, that was the maximum I read. I might be
Recently there has been a lift in the
recently there has been.
there has been discernible. But our point is one of the best all over the
Absolutely.
country getting placement.
Absolutely.
Yeah, 90% now it is.
So the second year एक ही को है placement anxiety, बाकी सब chill है.
Internship is
Internship anxiety है. बाकी किसी को नहीं है. So I believe that you are already in a good mental. कुछ नहीं है. That's really good. I believe that you're already. Alright. Yeah, so the point here that I wanted to highlight was what sort of package that I will get, or because that's also true that there's a lot of competition out there. Okay, I think roommates with different cultures and beliefs. Dikti has already spoken about it. Okay, yes. So the alphabet of avoidance is this. We cannot avoid when it comes to mental health. We cannot. Okay? And why I'm so sure about this? Because what common mistake that we do is we prioritize academics and social life over mental health. पार्टी कर लो, बाहर घूमने चले जाइए, ठीक है, फ्रेंड्स के साथ घूम लिया, या फिर हम पढ़ रहे हैं, we have completely forgotten about mental health. Okay? We feel ashamed and reluctant to talk about it. The way we started the presentation, right? We feel weak or we ignore, thinking that it is temporary, even if like Dr. Ankur said that we have to identify early signs, right? Some people they just very comfortably ignore it. कि कुछ नहीं हुआ है, temporary है, कोई बात नहीं, right? But it is important that if it is persisting and is not letting you do your day-to-day job, then it is important to address it. Okay? Fear of being judged, stigma of going to a therapist, feeling that it's merely overthinking or underestimating its severity. I have heard a lot about it. People say, oh, you're overthinking about it. Whenever they come and share their problems, even with their friends or family, they're thinking, नहीं तुम बहुत ज़्यादा सोच रही हो, ऐसा कुछ है ही नहीं, right? Then what we do is we create very unrealistic goals or false expectations. So कोई बात नहीं, I'm feeling very lazy or this that, कल से मैं gym join करूँगा. जिसने कभी 5 मिनट की वॉक नहीं लगाया होगा, मोबाइल छोड़ के, टीवी छोड़ के, has made up a standard कि कल से हम जिम जाएंगे और वो भी 1-1.5 घंटा, right? And unfortunately, this unrealistic goal leads to poor self-confidence. कि ये भी नहीं कर पाए हम, नहीं हुआ हमसे, because we have already set a standard so high that we are not climbing the ladder from 1, 2, 3, 4, 10, but हमको सीधा 1 से 10 पे jump करना है, right? Then we wait for the right time to come कि right time आएगा तब जाएंगे, वो right time कभी नहीं आता, leading to procrastination. Okay, this is another interesting point. That problem हमारी होगी, but we would want others to fix it. कि वो ठीक कर ले अपने आप को, मेरी problem तो ठीक हो जाएगी. Because my friend is so annoying, he doesn't know how to, put at, room with me, वो time पे सो नहीं रही है और overnight अपना काम कर रही है, तो उसको समझाओ. वो अपने आप को ठीक कर लेगा तो मेरी तो प्रॉब्लम ठीक ही हो जाएगी. But my dear students, this is something that we cannot control. 3 things that we cannot control: the other person's thoughts, their actions, and the way they will react to your actions. Correct? So all that we need to do is with us. So yes, nobody wants to take accountability. Poor routine, self-care, improper diet as a result of poor mental health, unhealthy media usage. Every time we are glued to phones, right? I'll be talking about it. And yes, there's a point I missed, self-medication. I've also seen this trend where people, I think Dr. Rampur will also put some light on it. People taking this Alprex or self-medication, नींद नहीं आ रही Alprex खा लो, anxiety हो रही Alprex खा लो, right? So this is also I've seen people doing it. So to give you a broader perspective of what I've talked so far, there is no identification of or awareness of denial. Okay. Then there is this stigma attached. Then because we already are, the schedule is such that हम लोग busy हैं, there's this busy schedule, then yes, students face this problem of limited funds. So that also restrict them from visiting to a psychologist or a psychiatrist, leading to low rate of adherence. Treatment तक वो पहुँचते ही नहीं. ठीक है? I think this I have already covered, that what a stigma sounds like. In your head, it's like, you always act like this, you're lazy, right? You're not being practical, you're very emotional. You don't like to socialize with us. Or we are casually using this word. He is depressed, he has OCD, right? So these are what stigma, you're faking it. Try and exercise, उठो बाहर जाओ, exercise करो, सब ठीक हो जाएगा, right? This is what stigma is like. It sounds like this to us. Okay, major disorders, I think Dr. Ankur has already covered this part. Yes. This was something that I wanted to talk just in a little more detail. Social media addiction. So what is FOMO? So what are you missing out on? What are we missing out on? Fun? Yes, absolutely. But do we need to be glued 24/7? Like, not literally 24/7, you mean? I mean, the majority of the time. Because see, if we talk about academics, if we talk about better lifestyle, mental health, तो वो तो वैसे ही खराब हो रहा है ना, because आप लोग इतना सारा chunk of your time you're devoting it to social media. And unfortunately, the content, I'm sorry, which is there on social media is not all is relevant. No. And what they depict, if you're following any influencer or there is celebrity or whatever, right? आपको लग रहा है उनकी real life? We get influenced by this is how they do it, this is what they wear. No. So how are we getting influenced by somebody who is not showing the reality? Hello? Getting my point? So there is actually no FOMO. It is, we feel that we are missing out on something very significant. Okay? We start comparing ourselves to them. अब सबको influencer बनना है. Every second person wants to make a video on YouTube. कि अभी YouTube से वो I have forgotten that that guy name. Who's that guy? हाँ? No, there's a young guy जिसके पास वो Ferrari वगैरह है, उसके भाई बहन भी हैं.
Saurabh Joshi.
Yes, absolutely. Right? The way he talks, the content, what is so informative? Tell me please. क्या informative है? What is he talking? He cannot even talk properly. No?
No, ma'am.
So, this sort of content is good for time pass and fun, and when you really have that mood to listen to that, But 24/7, क्योंकि मेरे को तो somehow social media पे almost यही दिखाई दे रहा है. Leading to sleep disturbance, especially bedtime में सोने से पहले when we are using this mobile. Research they've shown proven that it leads to poor sleep quality. This is a fact that I'm stating. Filtered reality का the kind of video जो आप देखते हैं real. And yes, we get used to this and it becomes an addiction and time management is problematic. So what we are going to talk about now, I will be not taking much of your time. We need to develop resilience, and that comes with being self-aware. And वो तभी होगा जब हम उस stigma को हटा पाएंगे. आप खुद self-aware होइए. You have to take proactive strategies. Okay. So combining this resilient, once you become resilient, you will be more confident, you will be more flexible, you have good relationships, you will your spiritual freedom, emotional regulation. So resilience is, my dear students, the key. And so now coming to what we can do. As Dr. Ankur said that there are different categories. This I'm talking about the preventive mental health measures. ये हम सब कर सकते हैं, ठीक है? What I can do? Stop comparing yourself with others. All of these things I'm sure आप लोगों ने पहले भी सुना होगा. You've heard all of this before, right? But the problem is कि कोई कर नहीं रहा है. Because people come to me, they say that I do not have confidence. Please give me confidence. Can you just ऐसे कर सकते हो मेरे लिए? Just give me your hand. Okay. So yes. So what did I just give you?
Confidence.
I just gave you confidence. ऐसे नहीं होता है ना? So the confidence is something that you build within yourself. तो ये सारी चीजें आपको पता जरूर है, but I am not sure if you are working on it. और जब तक हम work नहीं करेंगे, because I always tell this to my clients and students, you know everything already. It is just that you come for that reassurance and support कि हम जो कर रहे हैं या नहीं कर पा रहे हैं, आप उसमें differentiate कर दीजिए. And it's like somebody was asking me this question that how to go on a walk. I said, how to go on a walk? Just go downstairs, wear your shoes, buy a new pair of shoes and go on walks. What is so problematic? Right? Unless and until there is some, severe mental disorder or something that, is enabling, but like Dr. Ankur said, वो भी manageable है. With medications or something, we can come to that level where we can become functional. Taking breaks is mandatory. Time management, again and again I'm saying, is important. Identify the stress before it becomes a burnout. Pursue hobbies, and if you do not have one, please develop new interests. And there is nothing known as perfectionism, my dear students. There are people who would like to, and trust me, when I was making this presentation, तो मैं अपने आप से question कर रही थी, मैंने बहुत perfectionism खोने कर लिया इसमें, right? Because to draw that line, that this is like my highest capability of functioning, and beyond this is that that fade of perfectionism. वो line draw करनी मुश्किल है, but if you start practicing it, you'll know, right? Give your best where it is needed, but you cannot in every at every step in every task you cannot be that perfect. Imagine हम कितने exhaust हो जाएंगे, right? Overcome fears in graded manner. Identify your fears, okay? सबसे छोटे fear से शुरू कीजिए, पहले उसको overcome कीजिए. That will motivate you to go ahead to the next one, then the third one, fourth one. तो graded manner में जाइए. कोई problem नहीं है. You do not have to solve all your problems overnight, and no one can do it. Even if you come to me, I cannot help anybody that way. See, एक ही बार में बैठेंगे, एक ही session में सारी problems का हल हो जाएगा. No, that's not how it goes. Stay socially connected. Aren't we known as social beings? Are we? Right?
Yes, ma'am.
But why do we isolate ourselves? We do. Right? Isolation in terms of mental block, किसी से बात नहीं करना है, phone नहीं उठाना है, किसी से मिलने नहीं जाना है. And if you think that you're suffering from social anxiety, please seek help for that, because social connection is a very important part of making you resilient. That is the support that we need. Right? Because people also come to me, the most untouched thing that they do is that they say कि हम किसी से बात नहीं कर रहे हैं. We don't feel like talking or meeting anybody. ऐसे सबसे बड़ी गलती यही होगी. Prioritize self-care, limited social media use and engagement in meaningful activities or relationships. ठीक है? You do not have to be friends with 10, 20, 25 people together. It doesn't really matter आपके Instagram पे कितने followers हैं, और एक बंदा भी नहीं है फोन करने के लिए, अपनी बातें शेयर करने के लिए. So I don't really know where we are taking this followers to. There's no point having people following you in return, but you cannot even pick one person to talk to. Share with the one we trust. Okay? One is good enough according to me. For me, 1 + 1 is not 2, it's 11. So it's good enough. अगर एक भी कोई है, okay, to provide that support. Identify early signs, and yes, there's a lot of information on internet already. People come to me well read. Anxiety क्या है, depression क्या है, हमें social phobia है, ये है वो है. And yes, there's a lot of information on net, but this needs to be cross verified, because information overload also creates a lot of stress. कि किसको सच मानेंगे, किसको नहीं मानेंगे. वो साइकोलॉजिस्ट और साइकाइट्रिस्ट के पास जाने से पहले तो पूरा इंटरनेट, मेरे पास तो आके लोग कहते हैं कि मैम हमें ओसीडी है, हमें सीबीटी चाहिए. ऐसे कि सीबीटी भी ऑनलाइन पड़ी हुई है, आप उसको ही पढ़ के ठीक हो जाओ. Right? Whatever me and sir we are discussing today face to face, आपको कंटेंट तो ऑनलाइन में मिल जाएगा. Right? Okay. So there are some self-help guides also. Some books are there. I will not promote any. Okay. But I think I have found this useful for students. Okay, because like I said, the funds are limited. You can use this these books, but with some supervision. क्योंकि कुछ चीजें उसमें शायद नहीं समझ में आए. To get the essence of it is very. You can go through it. And yes, talk about mental health more and more. Okay? Why are we not moving ahead?
Last one.
Paper, yeah. So I think this is like a explanation, relaxation technique, physical activity, creative expression. आपकी you like to write, you like to draw, you like to stage, do whatever. Okay, social interaction, problem solving. Always address problem with the approach of finding a solution. If you keep talking about the problem, then you're not getting any closer to the solution. है ना? You're repeating the problem, but you're not focusing. And by the time आपका time आता भी है solution ढूंढने के लिए, the mind is already dead and exhausted because you've spent 80% of the time thinking about the problem only. Okay? Setting boundaries. This means start saying no. This comes as a part of assertive skills training. आप अगर किसी को ना कह रहे हैं तो वो आप किसी का disrespect नहीं कर रहे हैं. It is just setting the limit for yourself. कि मैं आज नहीं आ पाऊँगा. I'm very sorry about it. Please don't take it personally. Please don't get hurt. Right? I will not be able to, but I would surely love to join you the next time. Because ये जो art of saying no है, it's very important for self-preservation. Because I have seen population those who continue to say yes, इनको people pleaser आपने सुना होगा category बोलते हैं. For surely, if you do not change this habit, you'll surely land up in some sort of a stress, burnout, or anxiety. That is for sure. Mark my words. Time management, positive affirmation, right? Healthy diet, enough sleep, and avoiding substance use. So, here you asked me this question that we resort to alcohol, smoking, other psychotropic drugs as a part of coping. Yes, it is true. Or I would want to say that this is unhealthy. And you will always come across unhealthy and healthy choices in life. It is as simple as that. है ना? Choice तो घर के खाने की और burger and fast food की भी होती है. It is just about making that choice. That's about it. Readily available सब कुछ है. Burger भी है, ठीक है? Weed भी है, right? घर का खाना भी है, and other substances भी है. आप क्या choice make कर रहे हैं? That is up to you. And the coping skills that you will choose will make you what person you want to be or you are. That's all. So I would say it is merely about choices. That's all.
When they become dependent on
Yes, then seek
what
help.
can what?
Then seek help. Because there are medications, there are some specialized techniques. क्योंकि कई बार हमें किसी का support लगता है. I understand that you become dependent on it. कि आप खुद से नहीं छूट रहे हो. ठीक है? Then we need some support. Family support सबसे पहले. If not, if they are bringing you or taking you to some professional, तो उसका support लगेगा. ठीक है? And like I said, will, that's more important. Will to leave it. If you keep giving yourself justification, आज मैं stress में हूँ, so I have smoked 10 cigarettes more. I am in a party, I have smoked a complete package. कल से छोड़ देंगे, परसों से छोड़ देंगे. Again, these are all the game of mind. No, this is the justification that we keep on giving to ourselves. अब इसमें कोई और कुछ नहीं कर सकता. People can only give you support. And me, my role as a psychologist, I have always given a support to my client, a choice. Rest I always say that the choice is yours. I will not take decision on your behalf. Make sense? Okay, and I think this is time to wind up. As I think Dr. Shamba has gone for some work. This is my request to the especially the university and the authorities here, that you will have to build a specialized a team. Okay, ma'am, I think you're there. Thank you so much. I just wanted to just call from my question. Yeah, no, I know. Yes, I understand that. So, I think we've spoken a lot about awareness and stigmas, and I believe that we've done a long talk so far. Just my request that these talks and removing stigma and these things that we आपकी college or university support के बिना नहीं equally needing. So जो भी लोग स्ट्रेस में आए हैं कि फटाफट आइए वर्कशॉप है, ठीक है, वो भी, और जो अपनी मर्जी से आए हैं, see this is the first initiative that you've taken towards mental health, right? This is the first initiative, but it has to now proceed on to, at a broader scale where you make the, healthcare specialist available for more, because आपके पास if I guess students, would you agree if there is an on-board psychologist, counselor for you, will that be more easier for you to, go to them when you need, or will that help?
Yes,
So that's greatly appreciated and definitely it's there now.
Yes. So I think आप ना इसको ज़्यादा appreciate कर सकते हैं. And yes, just few things that we can also involve parents. I would advise at least for taking information in case it is needed. Right? In some case we do. And also assessing parents' mental health as well in case, because the counter effects parents' mental health indicates their situations and this and that, right? So assessing that is also very important. Timely referral for mental health services, organizing mental health awareness programs on a regular basis, establishing a healthcare center, especially with counseling services available to students during their work hours. Okay, so I think role of a therapist, I think I've already clarified a lot. We can help in stress management, help students achieve their academic, career goals, foster personal growth, development, can help adapt to healthy coping skills, develop resilience, deal with failure or rejection. I've seen a lot of people coming to me with one of such cause, failure, I'm not able to deal with rejection. Social interpersonal skills, and my dear students, because you're BTech students, उसका मतलब ये नहीं है that additionally we don't need linguistic skills, management skills, हमें technical के अलावा ये skills भी चाहिए when you will finally land up in, the outside world for job. These skills are equally important, okay? Because I think this will create a mark, because अभी आप देखेंगे even on the IS panel, right? There are psychologists and they read the body language and the amount of confidence you're carrying just merely walking through the door, right? The language, the way you make eye-to-eye contact, these are also important things that we try to inculcate in our sessions, okay? And to focus on overall well-being, healthy adult is the future of our nation and we all need to contribute in our respective ways. So thank you so much. This is where I end. And मेरा एक छोटा सा center है जिसका नाम Kairos है. Kairos का meaning है that moment where the chances of getting success is 100%. So I would end my presentation. Find your Kairos moment to facilitate change. I hope that you all find that Kairos moment soon. Thank you so much.
Thank you.
Any questions?
Ma'am, myself Abhishek from MS Psychology
Hi,
here.
Abhishek.
So ma'am, my question is, how do you think that the corporate lifestyle, like the recent example of TY, where the burnout is quite high, and other organizations as well that are counting on having Saturdays working, the work-life balance is low.
Having Saturdays working. Yes.
And plus the burnout is also taken as an advantage, like they're saying, they're calling it an ethic, like they're boasting about it. How do you think about that thing?
See, if you really want to take my personal opinion, I certainly myself do not encourage this, 6 days week of work, working. But if we know the system is like that, we have to equip that. So when I say that, even I am working 6 days a week. For us, for practitioners in private sectors, Saturday, Sunday is like the prime day for us. So what you need to do is, if you have work for those 6 days, all the more important that on the 7th day we relax and empty out that energy, you know, that we have taken. Because see, आप जो बात कर रहे हो उसमें हमें system बदलना पड़ेगा ना. That we have to really ask the companies or the sectors to stop this 6 days. I don't think that that's gonna happen very soon. Right?
It does not matter कि 6 days है, 7 days है, 5 days है. So what's important is that you should feel more happy at your workplace compared to your home. वो 7 दिन पता नहीं चलेंगे.
Yes.
Even I did computer science engineering. Later I switched into psychology.
Yeah.
Right now I'm working as a student counselor at Bharati Vidyapit College.
Okay.
So I definitely encourage whatever interests us,
Yeah.
that should be chosen.
Yes, absolutely. No, I agree with sir that what you should be doing, you should be happy and enjoying that. But apart from that, sir, we do feel stressed, because I love doing my job, but as a psychologist, it is absolutely exhausting. It is exhausting. It is mentally draining, despite that how much passionate am I towards my work. तो मुझे एक दिन completely, so I use the word detox. Completely mental detox कीजिए. That is important because अगर आपको काम ही अच्छा नहीं लग रहा है जो आप 6 दिन कर रहे हो, so I would expect a early burnout. Right? So yes, that is important to enjoy what you're doing and passionate about it. But yes, taking breaks timely. The one that I have written that taking breaks is very important. And let's see if Sundays and Saturdays कब की आगे change हो रहा है. Yes, any other question please? So I assume that we are done for today. Thank you so much for your patience. Thank you so much for keeping your phone away for this period. I hope that you would not take it otherwise. ज़्यादा anxiety तो नहीं हुई थी ना phone को silent पे रखने से. See, that is if you can do it here, you can do it at home, right? Please do that, and you will see the amount of change it will bring. Your concentration power will increase. Your memory will be, more enhanced. This you will automatically see. Just make a slight change. Okay, thank you so much once again. And I hope that you will again for such similar mental health awareness programs. And thank you so much.
Thank you so much, Dr. Payal ma'am and Dr. Ankur sir. As we come to the end of today's journey, I hope you have all taken one step, however small, but towards understanding, healing and hope. May the thoughts shared today echo in your minds after a long applause fades. So I would now like to call Dr. Shampa ma'am to kindly address the vote of thanks.
Hello everybody. It's always, for me, you are the detox. I mean, when I see students, it brings out a reversal in me. I can't express my gratitude enough. Dr. Payal Sardev and Dr. I'm sorry, Dr. Payal Khokar and Dr. Ankur Sardev. This is indeed the first step. And many of you are involved in a lot of co-curricular activities, and as you know, binding philosophy of all the initiatives we take is to address mental health issues as well. So, for example, if we have this music festival called Rest and Let Us, so a jam session, an open jam session, encourages so many people to just come together spontaneously. And I've seen that change in people just by participating in the group. Agreed? Right? Yes. How many of you have participated in that open jam? So did you feel that vibe? So vibe creates a difference. As you have rightly pointed out in our classes, typical classes, there is a good combination of people of all strata of society. Many people come from really humble backgrounds. As a teacher, often I find that persons who probably come from semi-rural or rural areas who may not speak English so well, or not accustomed to a certain metropolis way of life, they are huddled together. They're huddled together. And there seems to be, that's another mental health issue, that they seem to have an inherent belief that we can't match up. English can. So this I've seen. I'm sorry. I'm not being a psychiatrist or a psychologist. I'm just trying to share some of my experiences as a teacher. And just to tell you that there's one student in my class who I know because her father is in my works in my colony. So when she came, initially she was typically of that. She belonged to that thing. That kind of a profile. But today I'm a very proud teacher when I encourage her to come to the center, participate, ask questions. And today she was, I felt so happy checking the NSUT semesters, and she was the topper. So, the idea, if you get the opportunity, you can work wonders. You can really work on this. Point is that it's not necessary for anyone else to give you that opportunity. And as far as mental health is concerned, there's an entire spectrum. And I'm sure all of us belong to some point or the other in that spectrum. There's no such thing as perfectly normal. I'm not normal, you're not normal. Nobody is really normal. It's a huge spectrum, and somewhere or the other we all have these issues, right? And there's no harm in coming. So one of the important takeaways from the speeches of these experts is that stop that, break the silence. Come up, express yourself. There's no taboo, there's nothing there to hide under the carpet. So with that, once again, I thank my young volunteers also, Aditya, Tarun, everyone else, you all. I hope next time we'll have a greater strength and you will feel, you will not feel the taboo in trying to communicate with each other. And especially identify those people who need a little bit of help from you to come up. A little bit of help from you. The slightest iota of positive touch, interaction, can really bring a person out of his or her shell and make a huge difference to his or her life. I'm sure that we are going to organize more such programs, and definitely my Honorable Vice Chancellor also has it in his mind to engage someone in the panel. We'll have more productive times together.
I will never say no if the university is keen for this. I will never say no. This is my commitment to all of you.
Thank you. For all of us.